We are now 5.5 months from a decompression of the bilateral greater occipital nerve with removal of the bilateral lesser and third occipital nerves, which are in the back of the head. And this was done for severe occipital neuralgia, which had been refractory to medical care. Can you tell us what your symptoms were like prior to this operation and how long you had them?
So my symptoms probably lasted. So my injury was 2018 in January, and
Which was 3 years ago.
3 years ago. I had symptoms every single day leading up to my surgery. I would have migraines ranging from 3 to 8 times a week, and I would throw up every single time I would have a migraine. So there's a lot of pressure in my head.
And where were those migraine? Where were those severe headaches that you were having?
Right here. They'd occasionally be across the front, but the majority of them stemmed right from the back of my head. Every time a nerve would twinge or anything, I would get them right away.
So the pain always started behind the head and would radiate up the head and maybe at times even to the forehead.
Yep.
But they always started in the back, okay?
Yes. And with that, I could barely move, or if I moved, I had very low range in moving my head side to side. And now, as you can see, I can do that. The only thing that I really have going on now is I have a little bit of stiffness, some knots in my shoulders, but just from the stiffness, but don't really get any migraines, have maybe 1 or 2 a month. That's about it.
And you were having them every day before?
Having them every day, multiple times a day occasionally.
So how much improvement would you say on a scale of 0% to 100% would you say this gave you over the last several months?
So this side specifically, I feel like I have little to no pain, so this would probably be 95%. This one probably be 90 because I have the occasional twinge in this side, but it's really nothing that I can't live without.
And this one was going on for 3 years prior to this. And what did you try before this?
I was in physical therapy for almost 9 months. I was getting dry needling, I was getting deep tissue massage on my shoulders, not my neck. I was doing exercises every single day to try to do that. A lot of resting, a lot of wearing my neck brace.
Did you have any medications? Did they do injections for you and things like that? Or oral medicines?
So I was on 6 different types of medications for migraines, neck pain. I was on steroid packs for something with my neck. That was right after my incident. And then I had, I think, a total of 12 shots. I had 4 in each side, and then when I saw you to do the numbing, I got more that day. I think when I went in February after my injury, those shots were once a month, and that was to try to freeze my nerves to help if that would help.
So you've been through the ringer.
Yes.
All right. Well, would you consider this a successful procedure?
100%.
All right. Thank you. We're so glad you're doing better. Thanks.